Hello all. It's been a very inspiring meeting, and I just realized this morning on the calendar that I was going to be speaking, so I want to first say good afternoon to everybody and tell you a little bit about our hospital in San Jose, California. Santa Clara County was established in 1850, as you know, San Jose was California's first capital for a couple of years before Sacramento. In the year 2006, we had about 6,000 deliveries at the hospital. It was the largest public birthing facility in the state. And one of the things that our benchmarking group, the California Perinatal Quality Care Collaborative that's based at Stanford, was interested in doing was trying to get the admission temperatures of all babies at the time of birth into a database if they weighed less than 3 pounds at birth. So I am a newborn medicine physician and head of the ICU at the Valley Medical Center. And since we were beginning to benchmark admission temperatures for the very first time in 2006, we thought it was an opportunity to shoot for the elimination of admission hypothermia in very low birth weight babies, typically babies who weigh a little under 3 pounds and some, 1,500 grams. And as the state began to put the admission temperatures of these babies into the database, we noticed that nationwide about half of the babies were being admitted to the ICUs hypothermic or with an admission temperature under 36 degrees. We know that this is a risk factor for mortality and other complications of extreme prematurity. And the hope was that as we increased our quality controls in eliminating hypothermia at admission, that we would begin to see a slow but sure increase in survival without major morbidities. Now, that is a hypothesis that is yet to be proven, but eliminating hypothermia is low-hanging fruit. So by 2009, we had eliminated hypothermia down to 0 in about 150 babies, consecutive babies. And won the Gage Award, honorable mention from the National Association of Public Hospitals, now called America's Essential Hospitals. And as you know, this is a group that represents 2,000 hospitals in the nation, including most of the university teaching hospitals and public birthing facilities. So I think subsequent to this, we have managed to show sustained maintenance of that performance. One of the things we did as part of a comprehensive bundle was advocate for delayed cord clamping and wait for 60 seconds before we put a clamp on the cord, in addition to many other things that a lot of people were doing at the time to keep the baby warm. And evidence from all the randomized trials had shown that the transfusion benefit of a few milliliters of warm blood actually kept babies warmer if you didn't clamp the cord. Now, in this very high-risk group of babies under 1,500 grams, about 70% are delivered by cesarean section. Once you get down to the smallest of those babies, up to 90% are delivered by cesarean section. So obviously, the dedication to elimination of admission hypothermia includes a lot of teams, including anesthesia, the OR staff, the obstetricians, perinatologists, neonatologists, and most importantly, the nurses in labor and delivery in an ICU that do a lot of the actual how and when of keeping the baby warm. So we've shown that with even using delayed cord clamping for 60 seconds for the last 8 years, that we have for 5 consecutive years had an admission hypothermia rate that is below 2%. And the statewide standard is now approaching the single digits at last. Until recently, until a couple of years ago, it was still at 16%, now at about 9% for the most recent data. What does that mean for survival without major morbidities? Major morbidities for extremely preterm infants include such things as blindness from retinopathy of prematurity, deafness related to so perhaps some of the treatment strategies and perhaps some of the diseases, cerebral palsy, mental retardation, degradation, and chronic lung disease. At these birth weights, it is known that about a half of the babies are able to survive unimpaired, and that's the national data from the Vermont-Oxford Network that represents about 40,000 of these babies in this cohort annually, and these are data from 2012-2013. In the state of California, in the 23 largest centers in the regional ICUs, survival without one of these 5 major morbidities is at over 62%, and for the best centers approaches 70%. So we can now say that as opposed to the national cohort from many different centers that have a 50% or 52% survival without major morbidities, as we commit to this, to keeping our babies warm and admission to ICUs, we predict that there will be benefits that accrue over time, and as I said earlier, these are hypotheses to be tested. We believe that delaying cord clamping is a huge asset and may provide a lot of additional benefits to babies, so I'm going to put that plug in. Finally, I would just like to conclude by saying that I'm truly very inspired by many of the things that have been said here today. And I remember the president saying, "Thank God for Mississippi," which is not unique to Arkansas. I spent some of my life in Birmingham, Alabama, and it's actually much more often used in Alabama. So I'm going to leave you with the parting room for improvement issue, because the president also talked a little bit about the difficulties with addiction in our society. And I'm just going to very briefly put that in there, because here in California, we can only say thank God for New Hampshire. We are number 2 in the nation for opiate addiction in California. And you should know that both the counties of Santa Clara and Orange County have, the DAs from both of these counties have initiated a tobacco-style initiative against Big Pharma for the excess of prescription narcotics that have infiltrated our communities. These happen to be gateway drugs, and since IV heroin is now getting cheaper than prescription narcs, this is an emerging epidemic, and it's affecting our babies at birth. So that was sort of my passionate plea to keep your ears tuned to the news. I think Lisa Ling had a special on the kids in Salt Lake City and how they're being targeted, because many of these kids have not smoked or even had coffee or even had a drink. But through prescription narcotics, there's a huge escalation. So individual cities have individual variations in drug problems. But for both our counties, Santa Clara County and Orange County, the narcotic epidemic is a huge issue. So that's my plea, since Bill said if we have a focused, razor-like approach to any problem, we could really solve it. So there are a lot of important people here, and I hope you will stay tuned to the narcotic epidemic in the country. And thank you very much. Our commitment is to eliminate hypothermia and to delayed cord clamping.